Hello and welcome to another CIS health testing webinar. Firstly, to introduce myself, my name is Dan Humphreys. I'm a dairy vet from Shropshire, and one of my roles is to provide CIS with some technical support regarding their health testing. And so today we're going to be having a quick blast through liver fluke. We're going to talk a little bit about the background to the disease. We're going to talk a little bit about the testing options that you've got to actually test for it. We're going to have a little bit of a discussion about what the results mean and how that might help us manage the disease in dairy herds. So without further ado, let's get going. So first things first, what actually is liver fluke? So liver fluke is a parasitic infection caused by Fasciola hepatica. We're going to be talking about fluke in dairy cattle today, but you can find it in sheep, you can also find it in humans, and there's plenty of other species that are affected by liver fluke all over the world, so this isn't a problem that's just limited to the UK. Liver fluke has quite a complex life cycle, which we're not going to go into huge amounts of detail on here. There is a link at the bottom of this slide for the National Animal Disease Information Service, which can tell you a lot more about the life cycles of fluke. But skimming over the details, the cattle actually ingest the parasite at grazing, grazing that's contaminated with particular water snails, and it's actually active migration of the parasite in the host that causes the big damage. So these parasites, they will be in the small intestine after being eaten, and then they will migrate quite destructively through the wall of the duodenum into the abdomen and then to the liver, and then they will trash their way through the liver until they can get to the bile ducts, which is where they like to be. So infection commonly occurs in kind of wet and warm conditions, where traditionally spring and summer in grazing cattle, because that's when the water snails are around. The water snails aren't active when it's very cold over winter, and when it's dry in the summer they're also not very active. However, we're seeing a bit of a blurring of the climates and the seasons nowadays, so the traditional risk periods don't exist perhaps like they used to. One thing to note though is the time from infection to clinical signs can be quite a long time, because we've got this big migration that happens, and we've got an additive effect of more and more fluke causing more and more damage. So we may see the infection actually happening in autumn perhaps, but the disease might only actually present itself in the winter. But like I said, there's a nice link to the NADIS service there, which goes into the liver fluke background in a lot more detail. I suppose the next big question is, how common is liver fluke? What's the prevalence of the disease? Because is this something we should be worried about on day to day, or is this something that's limited to just a few farms? The bad news is it's the former of those answers. We've got quite a few different data sets and different ways of testing for liver fluke that we're going to discuss later, but perhaps one of our biggest pools of information is actually from abattoir reports. As discussed, liver fluke cause a lot of damage when they migrate, and when they're migrating through the liver, that damage is replaced with scar tissue, and that is evident when we slaughter cows. We can actually have a look at the liver, and we can see with pretty reasonable accuracy whether that animal has been exposed to liver fluke or not. And abattoir reports in the UK suggest that somewhere around 80% of adult cows have been exposed to liver fluke, which obviously is a huge number. And so liver fluke is probably much more of a challenge on the animals that we farm than we think it is, predominantly. So it is definitely something that we should be actively considering in our herd management. The clinical signs for liver fluke infection in a herd or in an individual animal are very non-specific, in that they could be caused by lots and lots of different diseases, which is why the kind of diagnostic process in our tests is so important, that we can actually pinpoint the cause. Because what we tend to see with liver fluke is a performance loss. With lower levels of infection, that might actually be subclinical, because we might not notice. We might see things like milk loss. We may see poorer growth rates in growing animals. We may see poorer fertility. As the disease gets more chronic or the infectious burdens are higher, then we can start to spot the individual animals that are really sick. We will see weight loss, we'll see chronic diarrhea and scouring, and we may see bottle jaw. But again, these are symptoms that we might see in other diseases as well. So we might see something like that with Johne's disease, for example. So the differentiation of the disease we've got on farm is important. because it is so very non-specific. Which brings us neatly on to the testing methods for liver fluke. Going back a few months now to one of the first webinars we did on these health testing subjects, we come back to that concept of the two different purposes of health testing. We can split testing up into diagnostic tests that where we have a clinical suspicion of a disease, so we're testing to try and diagnose that disease. And we can split it up also into surveillance testing, so monitoring for the incursion of disease to enable us to take action at an early point if necessary. Looking at the diagnostic testing then, we're often in individual animals, but we may be talking about groups. We may have a group of infected animals, so it isn't always individuals. We have the antibody ELISA tests. We're going to talk about the antibody tests in more detail in the next slide. So I'm going to gloss over those now. But then talking about some of the other testing, and these are tests that we don't actually offer at CIS, but for completeness, we'll discuss them here. We've got antigen tests. So antigen, if we're all still familiar from the discussions of COVID for many months now, antigen is actually looking for the presence of the infectious agent itself. So in this case, we're looking for the fluke. And we can actually test feces to look for some secretions from the flucicide. And that's a reasonable test. It's not too bad at all. It's reasonably easy to perform. It tends to only pick up infections about 10 weeks since infection, so it doesn't pick it up immediately, but it does pick up infection earlier than, say, the fluke egg detection, where we're looking for eggs from the fluke that are making it through the feces. These egg-laying things only happen around 16 weeks after infection, so it's quite a long time from infection to adults and adult egg-laying, and so a lot of the damage will have been done by them. So in terms of diagnosing a chronically infected animal, yeah, those tests will do the job, but they don't necessarily pick up the recent infections. Of course, one diagnostic which does mean we haven't got to think about treatment afterwards is the post-mortem. And so we can look for post-mortem changes on animals that we think have had chronic fluke. You can find adult fluke in the bile ducts of cattle. We can look for the scarring in the liver, as we've discussed earlier. So post-mortem is not going to help that animal, obviously, but it may help the diagnostics in terms of a group of animals if we do actually need to do that. When we're looking at surveillance, again, we've got antibody ELISAs, and again, they're going to be covered in the next slide in more detail. We can do those tests again on the tests we mentioned before on groups of animals as well. So we can do pooled feces tests for the antigen. And one thing about that antigen test is it does actually give us a bit more of an idea of the amount of fluke. The degree of infection is probably a bit more accurate at that than the antibody tests. It is also with the antigen, it tells you whether it's there or not. So once we've killed it and got rid of it, the antigen test should come back negative, whereas, as we'll discuss in a moment, the antibodies can stay high for a little while. So it does tell us about the current nature of the disease. When we talk about fluke egg detection, again, one other point to mention is fluke eggs may be found for a little bit after adult fluke have been killed as well. So they're long to develop, but they're also quite slow to go after we've actually killed the fluke. They may still be test positive on fluke eggs for 3 weeks or so after the test. And again, we've got post-mortem. But in this sense, when we're talking about surveillance, and it's an underused kind of diagnostic tool, is abattoir reports for cull cows. These aren't cows that have left because we think they've got liver fluke. These are cows that have left for fertility issues, of being barren, or just for productivity, etc. They are a fantastic indicator of what's going on in the herd. So looking at those abattoir reports to see if we've got liver damage, to see if it's active or whether it's old, there's some really useful bits of information there. And if you're not getting that from your abattoir, sometimes it's worth asking, because a lot of abattoirs now will provide quite good comprehensive reports on what they found. So there's lots and lots of different options. The ones we are delivering at CIS most commonly are the ELISA antibody tests. So we'll move on to that without further ado. So focusing on the ELISA testing predominantly, ELISA tests that we're using here are for antibodies, and if we remember back to one of those webinars where we talked about the different types of testing, antibodies are produced as a response to a disease, an infection or a pathogen. So all they show us is that something has been exposed to a disease. It doesn't tell us whether that pathogen is still active or how much of it was, but it shows that there has been exposure. Now there is a link that says a higher positive suggests greater exposure, but that pathogen may have gone, and in this case the fluke may have gone and been dealt with, but the antibodies will still remain high for a particular amount of time. So they're very good at actually picking up very recent infections. It's probably the earliest test marker for fluke infection that we have is a rising antibody titer, so rising antibody scores. But to actually really do that, it's quite useful to be looking at the changes over time. So we might look at a graph that's flat and then starts to climb, and that might tell us, yes, we're now getting active fluke infection in the herd and we need to be managing it like that. So we can do these antibody tests on milk samples, individual milk samples if necessary. We can do them on bulk milk samples, or we can do them on blood samples as well. So we've got a few different options there depending on what we're trying to find out and what resource we're trying to put into it. The important thing to say is looking for the change over time is a real key metric. Which brings us neatly on to how we might approach surveillance for liver fluke in the dairy herd. Firstly, it's important to understand the risks for your herd and where those risks might be. This is a disease of grazing animals, but the disease actually might present a few months after grazing. So if you're housed all year round, all the time, that's probably not something that you're going to do a lot of surveillance for. However, if you're buying in animals and you don't know what they've done, that is something to consider. If your heifers graze but then your cows are in all year round, then yeah, we need to make sure we've got management strategies in place for your heifers and so on. So understanding what the actual risk is for you is important. I mentioned about testing over time being quite a useful thing with ELISA tests for the antibody tests, so we can actually see when antibodies begin to climb, because that might demonstrate active infection. So routine bulk milk testing is a really useful tool if we suspect that the herd might be at risk of liver fluke. We might do that quarterly, for example. Most of the herds I work with and graze animals do the test quarterly. And we can see quite early in the disease process when we're starting to see spikes, and we can reflect on our management processes and do what we need to do to make sure that we're doing the right thing. Abattoir feedback, again, I've mentioned it in the other slide, obviously. It's a really good thing to use, and it's there. It should be something that's readily available. There will always be cull cows. Sadly, how it is, there's always cull cows to look at, and they're a wealth of information in terms of lots of different diseases and health things as well. But fluke is one of the key ones we can get from there. And then, like I said, we may be grazing young stock and adult cows be inside. There are certain things we can do with targeted young stock screening where we obviously haven't got milk samples to go at, but we may decide to do some blood samples every now and then. We may decide with your vet that we're going to do some fecal samples to check. We may decide that we're not going to do very much until they actually carve in. So there's a few different options there, but it is worth understanding exactly where your risk lies. Before we finish, it's important that we talk about liver fluke control, and it's a challenging one with liver fluke. Managing the risks is easier than it sounds. So trying to isolate areas of wet pasture or where those water snails might predominate is difficult. Trying to improve field drainage in lots of systems is expensive. So we will always largely have risk. We can't manage the risk completely out of the system. So it's important to use the diagnostics well to support the decision-making processes about what we do next. There are lots of flukicides out there, but the use is complicated in dairy animals. There's lots of different things about withdrawals. There's lots of different things about the spectrum of activity. Some flucicides will kill right down to very early stages of infection. Some will only kill adults. And how you use them and when you use them is really something that should be covered in your herd health planning discussions with your vet. But it does need to be backed up by diagnostics to make sure that we're doing the right thing and that our programs are effective. So there's no solid answer here for you, sadly, but it is something that is very much worth discussing. How do we do the surveillance in this herd? Have I got clinical suspicion of disease? And then what treatments do we decide are necessary? And also, when might they be necessary? The fluke seasons change quite often, so the risk periods change quite often. So what we do one year may not work the next. So it's important that the second part of this is just a regular review. Is what we're currently doing effective? Do we need to do things differently? So it's a complicated one, but with some sensible pre-agreed plans, it really is something that's very manageable as well. And that's Liver Fluke all done and dusted for today. Of course, if you have any questions or you want to know more about any of the services on offer, then feel free to contact your CIS area managers. There's an interactive map online where you can click on your location and you'll get your local contact. There's also the head office number on this screen now, as well as the email address. So if there's anything you'd like to know more about or would have any questions about the services and how you might best use them, do feel free to get in touch. Thank you very much for your time today. It's very much appreciated, and I'm sure I will pop up again on another webinar before too long. Thank you very much.